here is the I want to discuss human development and access barriers. Basically. So human development, I use Amartya Sen's capability and freedom, the opportunity to develop or grow. I consider as immigrant, and I use the immigrant theory of push and pull off. That immigrant is coming here, that they are coming for better life. As human factor, they are very much skilled immigrant. They are coming Canada for better life, and consider that their skill would be evaluated. However, in this perspective, my research. So a little bit outline and introduction that I gave here is because considering the why I'm doing this research. You know, the conference board report of 2010, it said they all expect that immigrants are innovative. So here the immigrants are making Canada more innovative. And why? We use immigrants to address problem of labor shortage, economic development, even population growth, as well as investment. So why this is so important? And however, the literature suggests the visible minority immigrants, especially South Asian, in my research, are facing the accessibility problem, like appropriate health care access. And why Greater Toronto? GTA is because it is the biggest multicultural city in Canada. And why South Asian? As because South Asian is the fastest growing community, not only in GTA, it's in Canada. And in this perspective, my study analyzed the challenges that South Asian immigrants face in accessing the appropriate healthcare opportunities needed to maximize their human development in the Greater Toronto area. So I just a little bit of the, as because the Canadian government use settlement services for immigration integration. They consider that it's not like USA, like melting pot, that 12 bed only required, they're coming and build your future. But in Canada, as because I said the pull-off, so that very much human factor works, experienced, educated immigrants are coming. So for their immigration, Canadian government, even from the 1950s, introduced the settlement services. However, the settlement services was vigorously in the 70s, and in the mid-90s, municipality was included for the settlement services. And you know that now is immigration partnership leads are working. So in the GTA, you can see that there is a settlement service, and at the same time, the GTA hospitals, community, nurse, and all those are working. That's because it's the accessibility of healthcare. So at the same time, 238 settlement service agencies operating in 280 locations. So and what we call the neighborhood services. So in this perspective, still what is the result of the research? So we can find this. So my method is a mixed method, interdisciplinary mixed method. I collected data at the same time at 307, and from South Asian, proportionately I try to make it and represent it from age, group, country, gender, and all those perspectives. And same time as the research, as in quantitative research is researcher perspective, but I try to get the participant perspective, so I did the focus group as well. And I'm using the SPSS, the statistics, and I did the significance test. And here you can see that in the same time the control variable, I use the gender, length of study, income, and employment. So, what is the access barrier? There is a lack of healthcare info, experience barrier, no extended healthcare, and language barriers. So, you can see the cultural perspective, cultural different understanding of health. Since you cannot understand the culture and not comfortable with of research. And education, degrees are not recognized, still are not recognized, face barriers, still face barriers finding jobs, the degree is recognized, but employer is not recognizing the degrees and not working the same profession. And access-based income, you can see that less than 20,000, 31%, more than 31%, and less than 20, almost 40. So you can exactly check that their income, household income each year. And so here is one focus group discussion. Participant comments, you can see that immigrants have this mindset that they are immediately going to get a good job, they are going to immediately settle, they have to start from scratch, but how long is going to take, and what is the procedure going to be, and how frustrating it can be, that they are not ready for that. So the results, most of them get deep frustration, depression, they don't want to talk, they don't want to go out, they keep blaming themselves, keep blaming Canada. How many of these newcomers really have access to the social services here available for them is still in the questions. So here is how many have the settlement service access. Although this information is because there is a mindset that, oh, I'm going to Canada, I will be very fine. So the package immigration officer is giving, they don't understand what is settlement services. They just keep it. They say that they will be fine. And in my sample, only 27% attended some sorts of information session, and only 20% received some kind of settlement service. And then I did the significant stat that how this result is significant, statistically significant. They have before and after. You can see the change of the, the 146 said health was excellent, and after that only here sometimes 75 and going down. And the same is going down. How is going down? And then the increase is statistically significant that health is declining and how is declining. And then it was that how is accessing barriers relevant to the health access. I just read one of the South Asian immigrants who did not experience any difficulties getting health info or advice at better health. So who didn't have any access barriers, they are better health. Or like here, immigrants whose skills and experience obtained outside Canada, US were recognized in Canada and had better health. The recognized or get jobs has better health. At the same time, that I analyze the human development, how is developed, how they grow. So if you see here, those who had better self-rated health had better quality of life. And skills and work experience were not recognized had lived a lower quality of life. So here is how this data is statistically significant. And this is the research. And what is the policy implication? We have to think about the immigration policy, employment, social development policy, health policy, even settlement services policy. And conclusion, I want to say that according to this research, immigrants contribute significantly to rural immigrants, the sustainable population, rural economy, thus even the most utilitarian sense, good immigrant health benefit us all. From this perspective, immigrant access to appropriate healthcare services should be considered as priority.